Welcome you to another Facebook and YouTube Live. It is so good to be with you here in the springtime here where I'm coming from in Andover, Minnesota, here close to the Twin Cities. It is springtime and snow is starting to melt. In fact, most of it's gone. And so if you don't have snow, you're blessed. But here in Minnesota, it's almost gone. So spring is here. New life, and so thankful for that. And I just came back from a Minnesota conference of nurse educators just last week. I was up in the port city of Duluth. I was a vendor for Keith RN, and again, just a great opportunity to connect with some of my former colleagues where I first taught in community colleges here in my area. And again, there's nothing like face-to-face connection. So I'm hoping that many of you are able to make those connections happen again as we return to some sense of normalcy. I hope that you're going to be able to do that and get connected and reconnected to colleagues, as well as those that you know and those that you don't know. But I also want to let you know that I'll be speaking up in Minot, North Dakota next Friday. So if you're up in that northern part of the United States, I'm looking forward to sharing at the North Dakota Collaborative Education Conference on Friday, April 8th. And then just a couple days later, I'm going down to Seattle to the ATI Summit as a vendor. So if you're going to that, put that in the chat. I'd love to connect with you and just let you know that I will be there and look forward to the opportunity to have that time with you. Just give me a shout out in the chat. Let me know where you're coming from today. One of the fun things is coming at you, here in my home office. I don't know where you're all coming from, but it's a blessing to have educators from across the country. So please go ahead and put your name in the chat. Let me know where you're from. Give me a shout out. And if you're checking this live stream out for the first time, I do this about every 2 weeks or so. And my goal is to serve and to support the needs of educators in the trenches, people like yourself, and empower you with practical strategies to better prepare students for both practice, real world realities, as well as NCLEX licensure. So great, Lisa from Montgomery County, Pennsylvania. Awesome, on the East Coast. Indiana from Woodstock, Georgia. Destiny from North Carolina. Great to have you all here. And just go ahead and they'll trickle in here. Karen in Reinhardt University in Georgia, and Purdue in Georgia. So we got some people from the southern parts as well as Iowa. And great to have you all here tonight. I just want to let you know who I am. If you're checking this out for the first time, my name is Keith. I'm the founder of Keith RN. And, my why or vision is to why am I doing this tonight? Why have I been doing Keith RN for about 10 years now as a brand new educator and serving the needs of educators? Because I have a passion to lead the needed change, to transform how nursing education is taught, because there's a gap, and many of you know it, that is between how nursing is really experienced and practiced and how we're teaching it. It's too big. And it's been around for almost 50 years in the nursing literature. I want to be a part of the solution. And I know that every one of you who are here tonight are taking time out of your busy schedule because you also recognize the need for change and really want to introduce a new mantra in nursing education. It's called practice first. Let's basically remember and put first things first, that if we are a practice-based profession, and yes, NCLEX is important, but let's mitigate NCLEX success with putting practice readiness first. And let's get a new hashtag out there on social media, practice first. And so, to do what I do to help serve your needs, my mission is to partner with educators. I can't do this alone. To transform how you teach nursing using case studies. And I've just written literally over 100+ that's on my membership site with other educators to really bring practice realities and a practice-based framework of clinical judgment to our classrooms, to our clinical post-conferences, and to lead with practice is really my passion. So I'm excited to have you here with me tonight. And 3 weeks ago, we did a Facebook Live on pathophysiology concepts that are most important. And when we look at concepts, we've got over 50, 60+ in Giddens textbook. And I'm not going to go over it. I'm going to share where you can find that that session from last time. I'm just going to pop it in the chat here. So let me just let me pop that in here, and let me just there we go. I'm just going to where you can find this. Last 3 weeks ago, we talked about pathophysiology and concepts. And, really the most important concept our students must master, clinical judgment. It is a Giddens concept, and it's complicated how to get there. But our students must understand essential content, especially pathophysiology, and anything related to patho is really the golden science and the golden thread of critical thinking. And so you think about the ABCs and oxygenation, perfusion, those are a close second and third. And so I shared more on that. So please check that out if you'd like. And I've got over 100 videos on my YouTube channel for educators, for students. And these Facebook Lives also recite on YouTube in my YouTube channel. So be sure to check that out. And, finally, one other resource I just want to let you all know about that is really a powerful resource is a Facebook group called Teachers Transforming Nursing Education. And, I'm the admin for that group. It's almost 11,000 educators from around the world. It's a supportive community to help you put practice first, transformation first. It's a collaborative community to help educators support each other, share your tools and resources. Ask any question. It's a safe place. So if you're not a part of that group, I want you to encourage you to be, again, it's a closed group. So not everybody gets in, especially students. Let me know you're an educator. I'd love to get you inside. If you're not a part of that community, please make that a priority. We need each other. We need each other. And, one thing I want to share in my journey and story is that, I'm a type A driven dude, and I don't know when to stop. And I don't think I'm the only one out there that has that problem. I recently read a book. I just want to share the title with you and a couple nuggets that I really want to just encourage your spirit and some things that maybe some of us all struggle with. And the name of the book is called The Ruthless Elimination of Hurry: How to Stay Emotionally Healthy and Spiritually Alive in the Chaos of the Modern World. And, when you look at the pandemic, you look at the crises that are facing our world and our nursing education, the profession, it's overwhelming at times. And how many of you as educators, when I look at my even what I do with Keith RN, can anybody relate to this? You're on a wheel in your office or in practice or in your classrooms, and you're just spinning and you're spinning, and it just feels like you just don't know. It just doesn't stop. I had emails that filled my inbox, and I just couldn't, I never got on top of it. But, the bottom line is that, we need to really, I think, we can talk about self-care, but I want to talk about being ruthless to eliminate hurry, which is really the essence of having too much to do. And, we always have our to-do list, but the bottom line is that, are you doing it with joy, with strength? We need to have a sense of presence and calmness, and really kind of just sometimes that perpetual motion, it's destructive and even violent to your soul. You've got to learn to slow down. And I'm still learning, so I haven't got it all figured out. But what I do know is this little quote here is that we need to slow down and simplify our life around what really matters. And, we need to remember that, the relationships that we have are precious. Your faith, your relationship with God, your family, your spouse, your significant other, those relationships, when you're in hurry, you don't spend time, you don't focus. And I just want to encourage, and it's really kind of preaching to myself, reorganize, reflect on what really matters, those relationships. Are you nurturing those? Because hurry really eliminates and really destroys those things that are most important. And, like the old Joni Mitchell song in the 60s, you don't know what you got till it's gone. And things can change. Life happens. People die. Let's put first things first. I know that nursing education is important. What I'm doing with Keith RN is important. But in the past, I've sacrificed my relationships, my, things in my family because of this burden of Keith RN. I'm a driven dude. And some of us are really focused on academia, our students first, and we just sometimes pour out ourselves too much. We need to know when to pull back and know when those boundaries are. If you're always tired, if you're always exhausted, even if you sleep well, that's stage 1 of burnout. So let's be really careful and intentional to take care of ourselves. So let's dig into today's topic. We're going to talk about practice-based nursing assessment, and we're going to go until about 9 o'clock. So we're going to really, we've got a lot of content to cover. I'm excited to share this with you tonight because really one of my strengths in nursing education is that I'm 36 years in clinical practice. I never left the bedside when I pursued my baccalaureate, my master's, even my PhD in nursing, is that I had a Baylor weekend program. Thank the Lord for that. And so as a newer educator, less than 10 years, I basically I worked weekends and never left the bedside. So even though these are cheaters, they're not bifocals, really what my strength is, I think, and how I think the perspective that I bring that is different than a lot of other speakers and people who are out there in the educator marketplace is that I'm recent in practice. And I bring a practice-based perspective to nursing education, which I think sometimes gets lost in the weeds of NCLEX success and how we really need to change culture. If there's one thing that I want my mission in this earth to accomplish within nursing education is to put practice first. And so as we look at practice-based nursing assessment, the problem is this. We're teaching over 120 specific nursing assessments. That's according to some studies that are out there in the nursing literature. I'm going to share them with you so you know that I'm not just blowing a lot of smoke tonight. I'm going to basically bring this to you, and we're going to, let me just pop this in the chat. And some of these references, so you can kind of see where I'm coming from and where these are. And again, you can download these. So again, the first article is on improving physical assessment and clinical judgment skills. And they identified that we're teaching about 120 skills in a typical nursing assessment throughout the program. But you know how many we use in practice? 25 to 30. And so what we need to remember is that infobesity isn't just something that's a part of our curriculum with our classroom content. Infobesity is clearly present as it relates to how we're teaching physical and nursing assessment. And the summary of one of these articles that I just posted the link on had this conclusion. Nurse educators must continue to discriminate content taught in pre-licensure nursing ed programs and should consider the attainment of competency of essential skills that lead to optimal patient outcomes. Anybody else want to say amen to that? And so when we look at the solution, how can we as educators be part of the solution to really strengthen physical assessment in our program? It's really simple and it's counterintuitive, and many of us are going to struggle with it. We need to teach less so our students learn more and acquire a deep knowledge of what is most important to practice. Let's have a couple of things I want to rattle in your head tonight that I want you to take away. Number one, practice first. Let practice first be the filter that you as an educator, because you're also nurses, never lose sight of the perspective that you bring as a practicing nurse or a nurse that's recent in practice or at one point in your life. You know what it takes and what a practice-based nursing assessment looks like that a nurse does 95% of the time. It's 30 skills. See, the problem, like with classroom content, that's so much information, too much textbook, everything that we do, they don't know what's most and least important. See, your students are novice learners, and Benner's Novice to Expert clearly communicates that they see everything as equally important. That applies to your content. That also applies to your physical assessment skills. If you're teaching 100 skills, 120, they think every one is equally important. And let's just be real, they ain't. They simply are not. And so as we look at this, I just want to encourage a lens. When you look at glasses, I've got my cheaters, but let's have a perspective as nurse educators. It's really simple. Practice first, but then we're teaching first-year generalist nurses. First-year generalist, not specialist, not nurse practitioners, not advanced practice. First-year generalist. And so really, I want to advocate change because we've got to change how we're teaching nursing assessment in our programs. And so, I really want us to really kind of, I want to empower you just to look at it differently. Look at your content differently, not just nursing assessment. We're going to talk about that tonight, and we're going to have a lot of fun with it because we're going to kind of poke a little fun of the nursing education bear tonight. But, I just want to kind of take a look at some of the comments that are coming in because I also want to make this relevant and answer your questions because you're all here tonight and I want to have some dialogue. I don't want to just be a Keith RN monologue. I talk too much. So Jennifer says, I teach health assessment. I recognize the need to teach less, but they are tested on obscure assessment questions. Oh boy, Jennifer. Well, again, you know what, Jennifer? Who's teaching obscure or who's testing these obscure assessment questions? Let it not be us as educators. Let's be sure that we're assessing and evaluating on our exams what is most important to practice. And so again, let's not get hung up on these straining gnats and we're swallowing camels. Let's not do that. Let's look at what's most important to practice and teach practice and evaluate and test practice. So again, that's just really would be what I would take away. Jennifer, if you have any thoughts or comments, please do that. And Barry says this, practice first, teach less, students learn more. Barry, I would love you to basically just make that a mantra, make that an anthem, kind of like, like Twisted Sister, we're not going to take it. I think as nurse educators, can we just have this anthem kind of rebel against the system a little bit? That it's practice first, teach less, students learn more. That's beautifully stated. That's the heart of what I'm trying to communicate, Carrie. So thank you so much for just capturing that. And so, yeah, Lisa says this, sick versus not sick. This is what I strive for in the ED with new nurses. Yes, Lisa, that essence that, how does that patient look? And do they look sick? Do they look ill? Is it congruent with their nonverbals, their verbals? So great insights. And so, yes, I'm just looking at some of these questions, that are coming through. And so let me just, I'll just kind of go with this thought. I just see one little comment here that I'll put on the screen here. Let me just put it there. There we go. Brenda says, I couldn't agree more. I recently have been accused of spoon feeding students because I flip the classroom and play games and facilitate hands-on skills. And you know what, Brenda? I don't know where students get this mindset that they're teaching themselves. I hear that everywhere. Students are students, I think, regardless, because they're people, they're human beings. But, the bottom line is that, yes, we need to make learning active, and we'll kind of, keep going here. But you know what? And Amy has a really good point that I think I'm just going to highlight briefly. She says, we're desperate for clinical instructors. Sadly, most of the faculty teaching right now would not be competent at teaching a clinical. And, one of the things that we need to change the paradigm in nursing education, we can learn from the medical model in the sense that, the professors in medical school, literally everyone, the majority here where I practiced here in the Twin Cities here at the University of Minnesota, where the residents came through, I asked them this question. They said every professor is current in practice or research part-time. They are not divorced from practice. And I know that in nursing education, the culture, we don't value practice. We don't give credit hours for being casual or being a 0.4. We need to look at that because we need to bring that clinical salience into all that we do. That's another discussion. We're not going to go there. But anyways, let's kind of keep going here and just kind of drill deep on really what I want to ask a really important question. And I want some things in the chat tonight. What can we let go of when it comes to nursing assessment? What are we teaching currently in your program that as you look at the skills, and even, you know what, our nursing assessment textbooks don't do us any favors. They're not emphasizing practice. When I look at some of the nursing assessment textbooks out there that are used in programs, many of these skills are totally advanced practice skills I've never used in 36 years of acute care in the ER, ICU, rapid response team. I don't use the skills in the assessment textbooks, and they're teaching it. That's a disconnect as well that we need to remediate. But I want to know some of the thoughts here. Lisa says the tuning fork. I love that. We got to put the tuning forks away, Lisa. Let's do that. I mean, I want to see you as educators listening to me. Can we just say rise up and say, we're not going to do this anymore? Why are we doing this? Can we just simply ask the question, why? Like we ask our students, give me the rationale. Why are we teaching tuning forks? Why are we teaching the Weber and Riney tests? Can we let go of percussion? I've never used percussion. If you're an advanced practice nurse, NP, doing some deep assessment with palpating the, some of the organs or the lungs, but absolutely. And, the textbooks don't do us any favor. You're right, Brenda. And again, we as educators, we got to be like filters, just like we have to do with the textbook content. We got to say that's TMI. We don't see that in practice. This is not first year generalist. With nursing assessment skills, we have an ethical and moral responsibility to teach practice and to teach a good practice-based nursing assessment. And so as we look away, some of these auscultating pulmonic splitting, are we really teaching that, Maureen? Deep tendon reflexes. Lisa, I agree, though I have gotten pushback because OB nurses will say, we do deep tendon reflexes for magnesium. And I agree with that. But you know what? OB is a specialty area. It's not first year generalist. So are we going to teach reflex hammers and doing deep tendon reflexes in the knee, for example, just because a small percentage, like less than 5%, may work in OB as a full-time job after their first year of practice? Let's not do that. Let's, again, teach generalist practice. And again, most of nursing assessment. Now, Brianna, I would say that there's two levels of nursing assessment. There is the routine assessment we're going to talk about tonight, but also if I have a stroke patient, when I was working, on the neuro floor, as well as in the neuro ICU in the critical care float pool, we would have to do those advanced neuro skills. And if you did on the floor nurse, if you are on a stroke floor, or if you have a stroke patient, we do need those pieces. And so, yes, Lisa, no one percussion. It's like, and I hope we're not teaching these things. And so it's like, we just need to step back. I want to empower you as educators. You don't need me to tell you this. I just want to empower you to kind of question authority, question the curriculum, if we're teaching these things. And so anyways, let's basically dig in to what we can do. And, these are some of the things that when I looked at some of the articles in the literature, you're absolutely right. These same things of evaluating the olfactory nerve, to do the ophthalmoscope and the otoscope. Again, advanced practice skill, put it away. I've not done that as a practicing nurse, and most of you haven't either. So why are we teaching it? So again, the percussion and those other palpating the abdomens and the liver borders. This is in our assessment textbooks, by the way. That's really what I don't get for undergraduate nursing education. I don't get it. And so anyways, let's be willing to question authority and question what we're teaching. And so anyways, yeah, Brenda, so let's question and let's go on there. So anyways, and let's just, again, in a positive way, be the needed change. And so let's kind of go into this and say, why is it so important that we teach assessment in a practice-based framework? Well, this is really because assessment is part of clinical judgment. You know, my passion is to strengthen and teach clinical judgment skills to our nurses. How many of you know that for that next gen NCLEX and just practice as well? Let's not just focus on next gen, because next gen is going to come and go, and it's going to, dust will settle. But practice readiness is always going to be relevant. And that must be, again, why we put practice first. But I want to share a little infographic for you that ATI gave me permission to share. And it's very powerful. Let me take off this little chat here. I'm sorry, I got to get that. I lost where I had that. That last quote of "We are desperate." Let me see if I can find it. Otherwise, I'll just put somebody else on. Okay, now we'll hide that. Good. All right. This infographic is very powerful from ATI. And what I want you to see with this is this first section, that first blue triangle. The outer edge is Tanner's framework of clinical judgment, a practice-based framework. Again, putting practice first, we start with Tanner's in the clinical reasoning of these 4 skills of notice, interpret, respond, reflect. But if you notice, they align with assessment of nursing process. This middle is the assessment. And again, noticing aligns with assessment. And then assessment aligns with the next gen model, which is a test framework to evaluate clinical judgment, not to teach practice. Let's not fall into the error of teaching the next gen framework to students when it's really meant for educators to write test questions and evaluate it on next gen NCLEX. Even the NCSBN has said that very clearly. But let's not, some educators and prominent educators are advocating something different, and I strongly disagree. But what I want you to see here is this: noticing of Tanner's framework. What do you notice? Aligns with the assessment of nursing process. And really what we need to remember with our students as novice nurses, they are concrete and they're task oriented. You know that. You know your students are task oriented, and that's just their developmental skill. As they get more experience, they grow and they begin to see a wider funnel. But at the beginning, that first year especially, they are task. They don't see the patient. And so therefore, when you teach nursing assessment to fundamental students, you know what they see? A task. I have to do my head to toe, and this is my steps, and these are my 100 skills, and blah, 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 and they go down the list. They see it as a task. What I want you to see with this infographic is the beauty of Tanner's framework and how it aligns with next gen. Because practice first, we start with Tanner. When you do an assessment, what are you noticing that is most important as you collect your assessment data, your vital signs, your assessment? And so what I want you to kind of recognize that is when we're teaching nursing assessment, we need to be intentional to situate Tanner's framework as a practice-based model of clinical judgment to help our students say, okay, you're doing an assessment as a task, but what are you noticing? What stood out to you with those breath sounds? Did you hear any crackles? And if so, what do they mean? So in order to teach the clinical judgment skills, we can't just teach the skill, the task. We have to teach the thinking, and then the understanding of the pathophysiology behind the assessment skill. And so again, we do that with interpreting as the next step, et cetera, with the analysis and planning of nursing process and the 3 steps of analyzing cues, generating hypotheses, et cetera, of next gen. The bottom line is that what does it mean? So really, there's a 1-2 dance that we must teach our students very early. It's what are you noticing that's most important? What does what you noticed mean? What does it signify? And again, this is the essence of next gen questions. It's also the essence of practice. And so therefore, let's make sure that we're doing this and that we are bringing these reasoning skills in addition to teaching the most important tasks in the 25 to 30 skills of nursing assessment. And so let me just take that infographic off, but I hope you found that helpful. And so therefore, that's kind of our goal and where we want to go with that. And so what I'm going to share with you tonight, I'm really, really excited because what we're going to do tonight is have some fun. Many of you know, I'm going to pop this in the chat here. So let me go back to my chat, and then we're going to kind of dig deep on our topic, and let's kind of go there tonight. And so let me just let me pull up. I just got a link here, got a download for you. I'm really excited to share with you. What I have is that many of you know that I've written and rewritten my student textbook series, Think Like a Nurse. And the second volume is right here. It just came off the press. It's not available for purchase yet. It's for students, but every educator will benefit from this resource. But the second volume is Building the Knowledge for Professional Practice, where I talk about the centrality of pathophysiology. The concepts that we talked about 3 weeks ago are actually chapters 1 and 2 of this textbook. I also go deep in pharm, fluids and electrolytes, lab values, but also chapter 3 is this excerpt I'm sharing with you tonight. And it is a portion of chapter 3, physical assessment, practice-based assessment. So it's my gift to you. And I want you to it's an Amazon S3 link. I want you to look at it. And I'm going to share a portion of my third chapter on practice-based nursing assessment, because it drove me nuts as because my passion for this textbook series is to develop clinical judgment, but also to help, again, bring practice realities to how we're teaching nursing. And physical assessment is a problem across the country in Canada. And so therefore, I want to be part of the solution. And so before I dig into it, I want to just share a couple thoughts about vital signs that are in the book and actually kind of come from that. When you look at vital signs, what vital sign is most important to recognize a change in patient status? And so when we look at vital signs, let's kind of triage vital signs and problem recognition. To prepare our students for practice, I want you to put in the chat, what vital signs, temperature, pulse, respirations, blood pressure, O2 sat, is most important to identify an early change in status. So I'm going to kind of wait for some of these to come through. And Joy says she bought my book at the Minnesota conference. It was a pleasure to meet you, Joy, and a great resource. So thank you for sharing that. And it'll be coming shortly. I'll be sharing the link here later. So Timothy says pulse. Jennifer says pulse, question mark. Pulse, O2 sat, respiratory rate, and heart rate. And you know what the most vital, if you want to kind of put it this way, teaching your students this, and it's in the book as well. What vital sign is most vital? To recognize a problem early. That's the context. It is the respiratory rate. And you're right. If you're in ICU, Joanne, it might be the pulse or the end-tidal CO2. But the bottom line is, if you're in a traditional setting, respiratory rate is the earliest vital sign that's going to change when there is a problem present. It's going to usually be increased over 18 a minute. The problem is, did you know which vital sign is the least accurate and not always recorded consistently is the respiratory rate? And so therefore, to problem recognition in the practice setting, we need to do two things. One of the things that we can do is to have our students record the respiratory rate for a full minute. One study was done saying that when it was only done for 15 seconds, the respiratory rate times 4, only 23% of patients who were tachypneic were recognized. When they did the respiratory rate for a full minute, 100%. It made all the difference. And so two things that we can teach our students about vital signs. I'm not going to go deep on this. I just want to kind of just throw a little pearl out there for fun before we dig into the actual assessment piece, is that teach your students to do respiratory rate, not for 10, 15 seconds, for a full minute, and then to breathe with the patient silently. So as the patient is breathing, you're kind of doing that silently. And you know what that does? You will recognize apnea or other abnormal patterns of breathing that are not rhythmic that you may miss if you don't do that. And I thought that was really fascinating. And so I've incorporated a lot of research in the literature that helps students and as well as new nurses and even educators, again, bring these pearls into how we teach nursing. So just a little fun and a little FYI. And that's all I wanted to go with. But now, so let me see if there's any comments here. Yeah, Tim says, thank you for this fact. You're so welcome. And, it's basically, whenever a patient begins to decompensate, it's the respiratory rate first that begins to usually go tachypneic over 18. So it's a trend. Remember, a clinical reasoning skill that we must teach our students across the board is trending. That's part of analysis, by the way. That's part of the interpreting phase of clinical reasoning, as well as part of the analysis phase of nursing process, is recognizing the trends, comparing the most recent to the current. That's why the next gen NCLEX does so much of that with the case studies, comparing one set of data to the next. Where's our direction going? And so therefore we must teach this skill and practice this skill at the very beginning of our program. So again, by just simply changing the way that we teach, and again, teaching practice first, we can make a difference. Every one of you here who are listening tonight. So I'm so excited about that and so glad you're here. And so, yes. And so Linda says, PEDS is the only place that full minute assessment is emphasized. And Linda, it should be every care setting. It should be actually in adults because it is the most sensitive predicator of problem recognition in the nursing literature. When you look at failure to rescue, it's really failure to recognize. And you don't catch the trend because the data is not accurate. And again, that's where just doing these little things that a nurse does, taking the extra minute. It's only 1 minute, but it could make a difference between recognizing a problem and letting it go too late. So again, the stakes are huge, and let's really do that. And so anyways, let's get into the head-to-toe assessment, and let's go deep into that. And so what I'm going to share with you tonight, I'm going to kind of go into, let me just get into my screen here so we do this right. And I'm just going to basically have some fun, because what I'm going to do tonight is that I am going to share my book. That again, you're going to see the layout of it, and you're going to see what's in the excerpt. I'm just going to highlight some really important pieces. And Kelly makes a great point that vital signs are not done by the RNs. That's a potential problem, Kelly. And it's not that we don't trust our unlicensed assistant personnel, but they're, depending on the stability of our patient, we need to validate our numbers, especially if they don't look quite right. And so let's look at some things that we can do to encourage problem recognition with vital signs. And one thing that's in the book that I think is really important, it's also in your excerpt that I'm sharing with you tonight, is looking at adult vital signs a little differently. We all know what normal is, but I looked at a couple of early warning systems that are out there in the nursing literature and the medical literature for sepsis and problem recognition. And what I want you to recognize is that we have normal here on the far left, but look at the concerning for respiratory rate and the red flag for respiratory rate. Looking at the red flag, for example, with as it relates to the oxygenation and the O2 sat, that it's not just the number, but it's also looking at what's concerning and what is a red flag, because we want to be able to identify both and be able to make a distinction between, again, what is, when you look at those different things, looking at the difference between what's concerning and what's red flag. This is a really practical resource, not only for next gen, but identifying for practice. Was that heart rate too high? What is concerning? What's an absolute red flag? And what are the problems that it could be? Like, why is my heart rate going tachypneic or going tachycardic, excuse me? Well, shock of any kind is a compensatory response. And so therefore, again, helping our students just use something as simple as vital signs to help them to not only recognize what's concerning or red flag in the darker shade, but what could it mean? And so, really when I wrote this chapter, I wanted to write it from my lens of practice, problem recognition, and really helping our students go deep with that. And so what I'd like you to look at as we go a little bit, as I go through the chapter here, we're going to look at the first set of physical assessment skills. And as we look at that, let me just scroll down just a little bit here. The very first, the very first one here is looking at respiratory assessment skills. And so as you look at respiratory, I'm kind of an ABC kind of guy. And so therefore, let's again use the priority setting framework. Look at respiratory as usually going to be a priority. There's really just 4 skills that we really want to help our students understand and to really apply the practice. And so what I've done in the chapter, is really saying, okay, there's only 4. Inspect the chest, assess breathing effort, assess if retractions are labored or not, if their breathing is labored, and auscultate breath sounds bilaterally. But what I've done as well, because I kind of said, how can I help my students understand this content, not just do the skill, but then when you auscultate breath sounds and you hear crackles, what are some of the most common abnormal findings? And then what are some possible problems that crackles represent, that rhonchi represent? So when they hear something that's abnormal, it's not just, oh, it's crackles or it's rhonchi. What could the rhonchi or crackles mean? And so again, we need to kind of have this 1-2 punch within our nursing assessment that we're teaching really the most essential practice skills related to respiratory assessment, but then helping our students make the meaning of it, the clinical significance, or the why. That's going to prepare them for practice and problem recognition. And by the way, it'll also help them on NCLEX. So again, just 4 skills with respiratory assessment. And what I've kind of done with this content is kind of put in some icons of pearls that I have acquired over the years, some best practices that are in the literature, as well as just from my own lens of practice about auscultation and not listening over clothes, for example, and what that looks like. What I'm going to go next is the cardiovascular. Let's take a look at that. And so let's just, I'm scrolling down here to the next section in the chapter. And really, these are the essential. Every time you're doing a concise head to toe in the practice setting, there's just several skills. Number 1, assess cap refill. Palpate the distal pulses equally at the same time, like your pedals, post-tibs. Inspect and palpate for edema, assessing for pitting if it's present, if they have edema. Palpate their extremities and their temperature. Inspect their extremities for color and hair growth. And then again, auscultation skills is auscultating their heart sounds at the aortic, pulmonic, tricuspid, and mitral landmarks. And again, what are some abnormal findings? What are some of the possible problems? And again, so those tables are really helpful. And you have this in your excerpt. And so again, you have my consent to put it to use in your assessment teaching, especially in clinical, helping our students understand. And this is why we need to help our students say, you know what? Don't wear gloves to do a physical assessment unless they're on contact precautions. Your patient's not contaminated. How are you going to really get a sense of their of their warmth, equality, if you're wearing gloves? It's like you're flying blind. Don't do that. And some students are just obsessed, and even some nurses are obsessed in practice, and they see a role model. But as educators, again, let's always be discerning and ask ourselves, why? Why should we wear gloves doing a head-to-toe assessment on a non-contact isolation patient? I don't see the rationale for it. And if somebody has one, I'd like to throw it in the chat. But anyways, that's basically assessment of the cardiovascular system. And again, about 6 to 7 skills. Now, again, you can kind of see some of my icons here. I got some practice pearls, some red flags, and other things just to kind of help students identify what's most important. Then we're going to go to the next body system. And so let me just scroll down to that portion of the chapter. And it's coming right up. This is about assessing chest pain. That's another thing. That's a topic for another day. Let me just, we're just about there. Neurologic assessment. This is where we can get TMI if we're not careful. You know what? There's only 3 neurologic skills. Assessing mental status, level of consciousness, orientation, evaluate their speech, and assess if their pupils are equal, round, reactive, and accommodate. You know what's really interesting about a neuro assessment? You can do most of a neuro assessment on most of your patients without doing a neuro assessment. You just talk to the patient, you interact with them, you ask them questions. And by just doing that, you don't really need to be that intentional unless they have a history of confusion or have some other things that of dementia that you do need to intentionally assess. And so again, besides the pupillary response, you're really simple. And again, some of the common abnormal findings, like a new onset of confusion or lethargy. Okay, LOC is crucial. They could, what could that be? It could be narcotic oversedation. It could be a stroke, could be ETOA withdrawal. Again, some of the most common things that I've experienced in practice, as well as in the nursing literature. And so anyways, Brianna says, when is this complete book available? And Brianna, this will be available actually in about 3 weeks for purchase. It's going to be available next week for purchase. I'll share the link with you. And this is a resource that'll help faculty. It'll also help your students. And so it's kind of a resource I'm really excited to bring to you all. And I'm just going to finish this up, but I thank you for asking. I do go into comprehensive neuro assessment. I'm not going to spend time on that tonight, but when you're doing a comprehensive assessment on a stroke patient, I've got about 15 skills that you really just kind of, working from the head to toe. And I'm not going to go into it. You can kind of see it there. But in essence, again, a methodical, systematic, sequential approach. I want to keep it simple. I think sometimes our assessment textbooks, there's only 30 pages in the chapter, but it is chock full of really practice-based information. So now we're going to just go into the head, ears, and eye assessment. And again, really simple, looking at inspecting their lips and oral cavity. Remember this, is that when you look at dehydration, I have rarely used the tenting of skin turgor. I have learned from my experience in the ER, opening their mouth and looking at their lips. If their lips are dry and their mucosa is tacky dry, they're dehydrated because they don't have that shininess of a lot of saliva. And I've seen that consistently over and over in practice. And so again, I bring some of those pearls in. But again, looking at their ears, looking at their hearing. Again, most of your head, ears, and eye assessment you can do by just observing the patient. We don't have to. We have to kind of teach our students. It's that combination of looking at your patient as you're talking with them, and being intentional to assess your interactions with them to see if there's any red flags. And then, by the way, you do have some specific skills, but it's only about 25 that you do consistently. So let's go to the next section, GI. This is a lot of fun. GI is really simple. Inspect their abdomen, auscultate bowel sounds, palpate gently for tenderness palpation, assess their stool if they have one, color of it, the smell. Again, GI bleeds, as we all know, have that distinct odor in their last bowel movement. But again, that's about it. And did you know that when it comes to bowel sounds, you don't need to auscultate all 4 quadrants because it radiates throughout the entire hollow abdomen. You just need to listen in one spot for 30 seconds. And if you hear that customary gurgle, you're done. There is no reason to do the upper, the lower, etc. And this is coming from a textbook written by Stephen McGee. It's called Evidence-Based Physical Diagnosis. It's an Elsevier publication for medical students. And it's written in 2022. And it says that the research shows that when it comes to a physician and doing the GI assessment, listen in one place because there is no way you know where that's coming from. Therefore, you only listen in one place. Is that counterintuitive to most of us and how we have taught it? Let's use practice. I mean, this textbook can be purchased on Amazon for about $50. But it's a medical based, but a lot of great research and everything this physician who wrote the textbook uses research and practice, uses actually the literature, supports these thoughts. So just a little pearl to throw out there. So anyways, that's the GI assessment. Let's keep going. Let's now go to the urinary system. And again, we just want to focus on urine output, daily weight, and assessing the clarity, the smell, and of urine, whether it be in a urinal, or in a Foley catheter tubing, urinary catheter tubing. And again, that's really simple. We just got to keep an eye on those I&Os. And if they do have a catheter, assess that it's secured, assess for drainage if they have a catheter. And if it's a woman, assess her last menstrual cycle. And again, just when it comes to the skin assessment, which I think is the final piece here, again, just by assessing the skin color based on the pigmentation, assessing temperature, turgor, the presence of diaphoresis, inspecting wounds or surgical incisions, and again, assessing for redness over pressure points. So again, if your patient's immobile, if it's blanchable redness, that's not good. But if it's non-blanchable redness, that's a red flag. And so again, I highlight that with the practice pearl in the textbook as well, just derived from my lens of practice and what that looks like in some of those early pieces. And then finally, just a musculoskeletal assessment. It's basically just, again, by observing the patient, how they're moving, palpating their extremities, joints for tenderness, observing range of motion, and assessing muscle tone. And again, that's about it. And, I counted all of these and I went through it. It only came to about 30 skills. And so again, I used the nursing literature to really kind of guide that and inform kind of just how we look at this. And so I just want to encourage you all as educators to keep it simple, keep it practice-based. Our students are going to have several patients. Look at your typical, if they're in acute care settings, they're going to have 4 to 6 patients, more on nights. They don't have that 20, 30 minutes to do an assessment. They've got 3 minutes, 3 to 5 at the most. Let's prepare them for practice by teaching practice. And then focused assessment. I also talk about in the book later on towards the end. And so again, as educators, let's every one of us kind of be that needed change to teach practice. And, I'd love to get your feedback and comments on just kind of what your thoughts were and just how you're doing. As you look at what your program is teaching, I'd like to know what some of your takeaways or questions are as we kind of wrap this up, because I really want to get a sense that, Kim says she loves it. Good. And Destiny says, did you include palpation for the abdominal assessment? Yes, I do, Destiny. But do not palpate for the borders of the liver or the spleen, please. Just a gentle palpation for tenderness. And again, always doing that before you auscultate. And so anyways, just some thoughts here. And Chelsea says, I've always taught all 4 quadrants. I may be teaching my assessment teaching. And so Chelsea, get this book by Stephen McGee. It's the 5th edition, evidence-based physical diagnosis. And it is filled with pearls. Can you see all my tabs in this? I marked this book up and I drew upon it for chapter 3, not for the entire chapter, of course, but I referenced it heavily because it had such common sense assessment principles that keep it simple. We make it way too complicated sometimes as educators. And I mean, we're well-intended and the textbooks don't help us. But, let's remember, how we can shrink it down to really to do that. And, Kim says, I've never understood why we teach entry-level nurses graduate level assessments. Kim, one observation I have is that a lot of our educators are nurse practitioners. And that's a good thing. But they're advanced practice practitioners. And they're bringing, kind of like when I was a nurse, I made the same mistake. I was a critical care nurse. You know what I wanted my advanced students to be? Critical care nurses. And I brought all those higher level determinants of cardiac output to my content. And it was TMI. It was well intended, but it was not necessary. It was too much for a novice first year generalist that we're teaching. And so again, let's really simplify it. Let's teach practice and let's question why we're teaching some of these skills. And I really want to see change. I'm tired of the status quo. Is there anybody else who's tired and fed up with the way things are? I mean, and I'm not, I don't want to get angry about it. I'm not. But let's change. Let's question authority, and let's question our curriculum and the way we've always done it. That needs to change. And so I want to encourage you all to be part of it. I want to lead the charge. I'm willing to put my neck out there, and you don't have to like me, but I'm going to put my neck out there. I'm going to stand on this hill. And I know that many of you wouldn't be here and listening to this tonight if you didn't get that as well. So it's really my pleasure to have you here. And so that's kind of where I'm coming from. And I just want to share with you, what I'm really excited to bring to you all. I'm just going to share in the last few minutes a really powerful resource that I have spent the last year after my PhD program. That was a ton of work. I got that graduated in 2020. 2021, I went to work on rewriting my student textbook. And many of you are familiar with this book. You've seen it before. It's called Think Like a Nurse, Practical Preparation for Professional Practice, the second edition. Back in 2015, when I wrote it, this was my best attempt to help bring practice realities to nursing education. Then a lot happened. I grew, I got my PhD, and I learned a ton. And really what I've done now is basically taken what I've learned in my journey and helping to strengthen nursing education by basically kind of putting this book into 3 separate volumes. The first volume is called Laying the Foundation for Professional Practice. And again, on this web link, you can see the table of contents and you can go to that. But in essence, holistic clinical judgment is a new phrase I kind of have coined, but it's really true. We need to teach students to be caring, empathetic, and compassionate, because that filters how you interpret the data. If you're burned out or you don't care, you're not going to notice. Remember, Tanner's first step is noticing what's most important. And so therefore we have to teach our students. I got 3 chapters on student success written by experts on the topic. And then chapter 4 is on holistic and spiritual care, compassion. Professional identity is chapter 5. And chapter 6 is all about civility, professional behavior. Then chapter 2, and again, these are small. They're about 160 pages. So they're about 3/8 of an inch. They're doable and they're very interactive with the work text. The second volume is the one we just talked about, building knowledge for professional practice. And again, pathophysiology and making patho understandable to students, and then going into practice-based assessment, pharmacology, F&E, and plenty of case studies. And then finally, volume 3 is called Developing Clinical Judgment for Professional Practice. And this is where I go deep with clinical reasoning skills of Tanner's framework, noticing skills, talk about trending, talking about, just many questions that you can ask to really flesh out each of these phases of Tanner's framework that align with next gen, to develop the thinking skills, to put it all together, is volume 3. And so again, on this link, there's some additional excerpts that you can access and get an email sequence, as well as I've got pre-publication discounts coming out next week. I think I'm going to launch this on Monday in both an ebook as well as in a paper textbook. So you can I'm going to focus on faculty, because I want educators to kind of get grounded on these things and these principles that I'm sharing that are really things I've been sharing for the last 10 years. It's nothing new. But I've made a resource for students to help them understand what's most important to practice. And so anyways, I just wanted to let you know that I've got your back. And I also have another resource for many of you that some of you may not be aware of. But the last thing I just wanted to share with y'all is that I have a membership site called Think Like a Nurse that has I've taken everything I've done over the last 10 years and put it into one platform. It's an all-inclusive membership with 110 unfolding case studies that I've written or collaborated with across the entire curriculum. And I've got webinars, faculty development with contact hours. I've got tools for classroom, clinical, and student versions with the answer keys. So it's like you don't have to do anything except use these open-ended case studies that replicate Tanner's framework to practice the clinical judgment every time you teach in the classroom. And so really it's my passion to make learning active and to help you do that. And so I just want to kind of just in closing, just want to also let you know that I'll be doing an About Keith RN webinar tomorrow morning at 10 a.m. If you, I don't have the link with me here, but if you just go to my website, keithrn.com, go to the homepage, you'll see this live event that you can still register for. And I'd love to connect with you and just kind of share the bigger picture of what I'm doing with Keith RN to best serve the needs of educators, make learning active, bringing practice realities. And really what I want to encourage you all with is that it's not one or the other. It's not preparing for practice or preparing for NCLEX and next gen. When we put practice first, practice also includes educational best practice. And that means that when we do the things of bringing context to our content, bringing clinical realities to our content, emphasizing the clinical reasoning skills, we're going to prepare our students for both practice and licensure. And that's really my passion and integration. And so in closing here, I've got a lot of comments here. And so let me just kind of see what we've got here and just kind of what I may have missed here. And basically, let me just kind of go on here and let me just kind of, how do you teach patients spiritual well-being? Asked Deanna, how to assess. And, Deanna, I don't have time to go into that, but I want you to know that in chapter 4 of volume 1, I talk about that. And I go kind of just making that practical. And some of the assessment questions that you can ask a patient are included to kind of do a holistic spiritual assessment. And so again, it's asking the right questions, Deanna. And it's kind of like, asking even a question like, you're facing a really difficult challenge. How has your faith, or what have you used in the past to get you through difficult times and situations? And so again, bringing holistic realities is so important. And so Chelsea asked this, is this book aimed towards students to purchase or for instructors to teach from, or both? And Chelsea, I would say this, the new series, like my book, the second edition, this is really like the third edition, just expanded and completely rewritten. But I take it's meant for students. And so instead of just giving your students case studies and some of my resources, they have their own resource to really dig deep and understand some of these essential concepts, like I shared about practice assessment tonight. But more importantly, or just as important, it'll help educators, because I think many of us are muddied. How do we teach practice? How can we help our students focus on, what's most important? And so I got to know what's most important. I'm just going to guide you to that. And so as an educator, use your lens of practice, but the books will help any educator to really bring practice and really kind of say, yeah, you know what? I get it. Keith, I think the same thing. A lot of people, educators will say, Keith, you validated what I already am thinking. And it's like, okay, then mission accomplished. And so it's meant for students. I'd love to see it, as a recommended or adopted resource, but it'll benefit every educator and you'll benefit as well. So I encourage educators to purchase it first, review it, grow from it, learn from it, and go from there. And so anyways, thanks for asking that, Chelsea. Let me just see there's some other questions here. All right. Kim says, you're a household name here. Is that Keith RN? Can't wait to get my copies. That's too kind. Yeah, and Kim says the membership is well worth the price. For about $49 a month for an annual membership, you'll save hours each month. More importantly, you'll get your students making clinical judgments and practicing, I should say, clinical judgment skills that are essential to practice and licensure. So anyways, thanks, Joanne, for the kind comments and putting these resources to use. And, I just really say, guys, you know what? I couldn't do this without you. And so for those of you that are still with me, we're going to kind of wrap it up. But I just want to let you know that, all that I've done, and I know that it's been worth it. I've also paid a price. I'm going to kind of slow down and listen to the need to ruthlessly eliminate hurry in my life. And I hope you do the same. But I just want you to know, I just am really encouraged by just, that unless you put these resources to use, unless you really take the mantle that I hope to bring to you and bringing practice realities and preparing for practice, none of the change would happen, because I'm all about change and transformation and rethinking how we teach nursing education. So thank you for every one of you who are doing your part. And it's really a partnership. That's what I really love about what I do. It's not about me. It's about partnering with you who are on the front lines, because you're the hero. I'm just on the back lines, kind of supplying you on the front line troops. You're in the trenches. I'm just giving you the supplies and hopefully the encouragement that you need to stay focused, go the distance, and make a difference. And so just want you to know that I'll be joining you in 2 more weeks. We'll talk about pharmacology and fluids and electrolytes, how we can really, what is most important on those content areas. That's, again, the last chapters in volume 2. And then we'll talk about some of the chapters in volume 3 in the weeks ahead, and just really give you a big picture understanding of how you as educators can really strengthen how nursing is taught, developing holistic clinical judgment. And really what that really means is, in closing, is this: your students need to care. They need to have that foundation of professional identity and behavior. That's foundational to our identity as a professional nurse. But then they need to know, they need to understand essential content. That's volume 2. And those applied sciences must be understood, not just memorized. And when it's understood, they can use it and interpret their, what is most important that they noticed. The meaning becomes relevant and visible when they understand patho, for example. And then finally, we need to teach them the thinking skills, not just memorizing a 6-step model of the next gen, but helping them to deeply understand the essence of Tanner's framework as a practice-based framework in those clinical reasoning skills. That's volume 3. And so if we have caring and we have knowledge that's understood and we have the thinking skills, that's really, it's that simple. But it's also difficult because our students resist a lot of these things that we want to do to make learning active. And so again, want to encourage you to stay the course, and I got your back. And I look forward to connecting with you tomorrow at Keith RN in that webinar. That's a free, just my service to you as educators to share what I do, as well as in 2 weeks, we'll be back. So thank you again for all that you're doing to be part of the needed change. And I look forward to connecting with you shortly. So thanks so much, and you have a great night. Take care.